So welcome everyone to this I3h seminar. We are very happy to have all of you today. Thank you very much for attending this very timely presentation. As you know, I3h is about interdisciplinary innovation in healthcare. And here the idea is to mix insights from commercial electronics and innovation in medicine. As you know, I have one of these watches on myself. I can be monitored 24/7. Someday, maybe these widgets will be able to detect before I'm aware of it that I may be sick or something that may enhance even our pandemic preparedness in the long run. And so without further ado, I would propose that the three speakers today introduce themselves and detail the discussion. Thank you very much.
Thank you very much, Michael. I'm starting because I have taken the lead between the three M's here on this presentation. I'm Mattijs. I'm a full-time professor at Solvay, and perhaps before diving into the agenda, we can just show our respective interests. I'm the organization and management guy. I'm interested in organizational change and performance management, but also in the consequences of technology on work. So that is my profile.
So hello everyone, my name is Tobias. I'm from the University of Lausanne. I'm full professor in information management. So I have a more technical background, but also more a management background. And my interest in this project that we are doing is more related to as Michael basically said, the sensorization and datification of different areas that we see. And what I'm doing in my research is particularly focusing on occupational health, where the sensors are used to monitor, for example, stress, burnout, but also safety and risk assessments at work.
Hi, everyone. Thank you very much for inviting us to this seminar. It is our pleasure to have this presentation today about digitalization, especially focusing on healthcare issues. I am a professor of public management, public communication at the Solvay Brussels School, and my interests are centered around the introduction and use of digital tools in government management, but also government communication. And I have written quite extensively about the issue of let's say neighboring concepts such as transparency, accountability, but also the relationships that develop between the different stakeholders when you have this introduction and this use of digital tools in public sector organizations.
All right, so as you notice, we have a shared but fairly recent interest in what goes on around e-health from this rather management-oriented perspective. A second thing that we share is the interest around the co-production perspective on health. And we'll get back to that because it's important. A third thing that's important for us is interdisciplinarity. And I'm very happy to present in this seminar because I find that between the three of us, we already have some measure of interdisciplinarity, but probably actually we don't disagree enough between us. And we're making efforts in that direction, but we're a bit too homogeneous. And so having medical or legal input, for example, for us would be very interesting. The research is exploratory at this stage. We are starting. It's been more than a year that we've been starting, but research paths are long. So we seek your input. What we did at this stage is mainly based on the literature review and examples, case studies, and I will present a few of them during this this presentation. So the agenda for today is, well, a few definitions around co-production and health. What the digital aspects adds to this, and there Tobias will take the word. And then what's so special about privacy in this digital context? And that will be the corpus, the main aspect of our presentation. And so we'll go over examples, but also over some theoretical background about what privacy is and how it can be managed in general and in the care relationship especially. Okay, so I mentioned that our initial interest in this project, and it remains our main focus, is about co-production, because we are all interested in the ways that citizens and clients of public administrations can be involved in the production of public services. And that is a reflection that is rooted in fairly old work already, going back at least 40 years, that we can find in marketing and industrial economics, but that also pretty soon applied to public services. And there we have already work by Elinor Ostrom appearing from 1978, for example, who very soon made a seminal contribution to this debate in the public services. Now, she worked on police services. She didn't work on health. The same can be said about the review by Whitaker, and he already does a review and a summary of that literature back in 1980. And so the initial finding there was that in services in general and in public services especially, there is an inherent interdependence between the producer and the consumer. I mean, you cannot do any serious public security or policing without having a contribution from the citizens. You cannot do any meaningful teaching, for example, without having any participation, active, direct participation from the student, etc., etc. And the same applies to many, many service products in the private sector, but also especially in the public sector. Now, beyond that finding, which is purely empirical and factual, a literature also developed to draw the attention to the fact that this interdependence is something that should not just be put up with, but it's something that should be leveraged and capitalized on actively in order to improve the effectiveness of the public services or the quality of the services in general. And so it's something that you find back in the service dominant logic in marketing, in co-production settings in public administration, and I'll point to a framework which has gained a lot of attention here, published by Nabachi and her colleagues in 2017. But also, for example, it's something that can be seen in the digital domain with the way that commercial businesses engage with consumers and clients for their brand image through digital communication on social media. So it's a very wide and multifaceted aspect, that this aspect of actively engaging with the citizens and clients. But from a public administration perspective, especially, it also carries ethical and political undertones, because of course, wanting to implicate and to engage citizens actively into the public service process also connects to the whole problem of legitimacy of the public services and of public administrations, which might become strained in recent times. And so it's also connected to a democratic turn in public administration. Michael, you have raised your hand.
Yes, this reminds me of the so-called triple helix, which, as far as I'm aware, is not a fantastic success, even though everybody's talking about that. What's the difference in the commonalities?
Well, triple helix, to the best of my knowledge, is at the development process. I mean, it's something that's really in the design process. Whereas co-production is something...
Universities, citizens, and administrations, government.
Yes, but that's in innovation, if I'm whatever aware of it. I mean, it's a way of thinking about innovation systems. And the literature about co-production is wider than that, in the sense that it encompasses not just design and innovation, but also use, actual use.
Okay, thanks.
But Tobias or Vincent, anything to contribute to that?
I mean, that's a fair point to say, well, what we see, what I'm preaching in my courses in Lausanne, it's basically there is a disconnect between, let's say, innovation projects and what happens afterwards, so the use phase. So I think, as Jan is trying to say, okay, you need to already think about use or public value or long-term perspective of how things will be used in the future already during the innovation cycle. And that's not necessarily what's happened in reality. So people are chasing functionalities, particularly if you're looking into technical projects. They are trying to optimize in terms of budget, in terms of time, in terms of functionality, not necessarily in terms of use. That's a little bit sad story that probably will Jan show with the COVID tracing app then later on. But we'll see, come to that, I guess.
I see that Hilda is also a question.
Well, it's more a remark I would like to make for the triple helix with respect to technology transfer. And indeed, it's really at I would say, the stage of innovation and technology transfer. I thought it was three actors: government, industry, and academia. And the fact is that it's now more the quadruple helix, where the patients or the consumers are put in the center as a fourth and most important.
With the citizens, that's correct.
Yeah, well, okay.
You're right, you're right.
Thank you, Hilde. But yes, we'll get back to that issue of involvement and the separation between design and use. Now, that whole literature about co-production is something that can be found back in healthcare. It can be found back empirically, because of course, getting to successful care and producing health requires a collaboration, an active collaboration between the producer, the practitioner, and the patient. in order to produce not just care, because I mean, the patient has to collaborate, he has to be there already, but he also has to comply with the prescriptions, etc. So that's the process, but in the end, the point is to get to an outcome, which is health. And there too, I mean, there is literature which I didn't have the time to flesh out here, but which aims actively at making the best of this interdependence. And it's the whole issue of patient-centered care and the empowerment of the patient, etc., etc. Now, what we add here, which is specific about our research, is the way that information technologies influences this. How does the addition of information technology artifact affect this co-production process in healthcare? And Tobias, you feel like taking over here?
Yes, Jan. So as you have seen, digitalization is a buzzword. Now everything is digital, but there are some nuances and some differences which we would like to highlight in this slide. So in English, there is the word digitization, which we don't have in other languages. In French, numérisation, or in German, digitalisierung. It's always a little bit the same, but there is a difference between, let's say, digitization and digitalization, as you see here. So the first one is just take a paper-based form and transfer it to PDF. You don't change the logic. It's still a form, just another medium that you use. The next step would be to also try to improve the process behind that. And when we really talk about digital transformation, we go beyond technology. We also think in terms of organizational, cultural, and other aspects that need to be transformed so that the overall ecosystem functions. So that's the hard part. That's where the interdisciplinary comes in. So we need people that are, for example, experts in psychology. Changing routines, changing behavior is nothing that an IT expert is very good at. So if you really want to change how healthcare functions, and if really you want to achieve digital transformation of healthcare, you need to also have this cultural as well as organizational changes. When you read the media, when you read the news, everything, all projects that are done that involves a little bit of IT are digital transformation projects. But that's not what we are interested in. We are really interested in projects that try to transform overall the organizations or the system overall. And when we talk about the system, well, already back in 2012, I was reflecting about the term e-health and what does it mean. And I came to the conclusion that there are like two big bubbles. One is more in the area of personal health, independent living, and the other one is more rooted in medical informatics, clinical systems. Why am I differing these two bubbles? Well, if you look into the health system, public health system in different countries, the remuneration schemes are very different. The people, the language that people talk are very different. And also the end customer or the client, so to say, is very different. So if you go to the left-hand side, personal health, it's pretty much the consumer logic. The Amazons, the Googles of the world tried to get into this market with Google Health, for those that remember still Google Health and all these kinds of patient record systems. And now we see there lots of happening with Fitbit, Garmin, and all these kind of technologies. The watch that Michael is wearing is a good example of personal health and independent living. Here, the logic is really different from what is happening when we talk about e-health or core e-health. This is the right-hand side. So here we have the classic medical informatics world, where we have more also the disease in the center and not necessarily the patient, but more how to treat different diseases and how to communicate between these different stakeholders, family doctors, hospitals, authorities, etc., etc. And the examples that we will highlight are more from this kind of bubble. And if you dig deeper, yes, Jan, the next slide. If you dig deeper into this bubble, you have a different logic as well. So you can be very fine granular when you look at things that are happening at the bench, or you can go to more wider kind of problems, policy-related problems, and which are more on the right-hand side of the slide. And the examples that we will highlight in our presentation are more rather going from the bedside to the community, or for the community to the policy perspective. Jan, you are next.
Thank you, Tobias. Just to give a short example of a very simple support by information technology to co-production. Well, a very basic element of co-production is showing up at the appointments by the patient. And you have all noticed that more and more when we have an appointment with a health practitioner, we receive SMS reminders. And I mean, that works. We have recent research here at Solvay, for example, where you can see that very clearly. Well, actually, Emilie Estalzon's research was much more detailed than this, because her interest was in the differences between the categories, and she had an original contribution where she showed that there was significant difference between the categories, but I'm not going to that detail here. I just want to show that, for example, well, in some, depends on the specialties, but in some less urgent specialties, dermatology or gynecology, you have very significant differences. I mean, and well, hiking up from 87% to 90% attendance might not seem a lot, but you have to reason the other way around. Of course, this is 25 odd % less of no-shows, which is very significant from the hospital's point of view. So you have there a simple example of, well, digitization in support of co-production that just works. I mean, it's very simple and it's not problematic. Now, what we have come across more recently are examples where co-production with digitization doesn't work so well. And Tobias Mettler mentioned an example there with a Swiss platform which grouped vaccination data, which had to close down. COVID tracing apps are, of course, an example of privacy getting a lot of prominence in the discussion about the rollout of the app. And we're going to get back to that. Criticism of the lack of supervision of the Belgian Data Protection Authority. That Data Protection Authority didn't supervise the government services enough in its rollout of e-health services, etc., etc. Now, privacy isn't the only issue that arises from the digitization of healthcare. Dignity can be affected in other ways. For example, if you just have your doctor that keeps looking at your screen and doesn't seem to be looking at the patient anymore, it's a problem. That has nothing to do with privacy. You have a lot of problems around technical and usability deficiencies, etc. But it's one of the perspectives, and it's one that we came across. And our hypothesis is that it's a stone in the shoe of digitized co-production for healthcare, but it's one among several of these problems. So what's the deal with privacy, actually? I love that drawing by Kroll. That's back from the time when there was question of measuring the temperature at the airports, and of course Kroll imagined their customs officers and policemen having to take the temperature of the passengers. And so what's the big deal here? Of course, you have a first problem, which is a problem with privacy in general. I mean, I might not want, as a citizen, to have a policeman checking my temperature. And you have a more specific problem around informational privacy. I mean, to what extent is that information about my temperature possibly published, reused, stored, etc., etc. So you have two aspects of privacy. In French, it would translate to protection de la vie privée et protection des données personnelles, which are where the second aspect, data protection and information privacy, is generally considered as nested within a wider right to privacy. Now, privacy is recognized as a fundamental right, so I'm not going to go into any detail here. The two things that are worth noting here is that privacy is a right upon itself. I mean, it's not just because a lack of privacy has possibly adverse consequences. It's also that it's enshrined in a number of fundamental texts, and it is well, it doesn't need to produce any adverse effect in order to be recognized as a right. And informational privacy showed up fairly soon. I mean, actually, you have a report that's 50 years old already about records, computers, and the citizen's right from the US Department of Education, Health, and Welfare, which was a landmark in terms of information privacy. And you find back echoes of that early publication still in recent frameworks like the famous GDPR. Now, what's also interesting here is that we are inherently in something that has normative ethical dimensions and that need to be explicitly addressed. Public services are special with respect to privacy. Yes, Mattijs, you raise your hand.
Yes, well, first of all, thank you. It's very, very interesting. One question on the previous slide. Of course, with COVID, these issues have been tested a lot. When you mention the general exception in the patient's interest, there is, of course, here you have it as a singular, and therefore, indeed, you may want to protect the patient against himself or herself's urges. But there's also, of course, in the case of contagious diseases, the patient's public, the plural interest, and my freedom stops when your freedom starts. And so I guess these things are, we have trampled on privacy a lot, and for reason, I think, even though at times it was a bit excessive. But I guess there is this, on the one hand, you may want to be paternalistic with respect to the true interest of the patient. The patient may not be able to understand what his or her interests are, but then there is also the externality. And I guess in that sense, it's not a right without limits.
It certainly isn't. And I mean, there is explicit reference to that in the GDPR, in the regulation. It's not just individually in the patient's interest, as you say. There are provisions for public health and purposes of general public interest. I mean, those are exceptions that are foreseen. And what the GDPR aims that in that context, if I remember well, is then the notion of proportionality, which opens a can of worms in which I will not go here because, I mean, we're going to try not to focus too much on the COVID tracing problem because it's a topic upon itself. But I mean, we are definitely in something that is special in respect to privacy. And it's special because it's about health, but it's also special because public services have special features with respect to data governance and data use. I mean, we're not in the sort of business model that people have come to refer to and to have references about in the private sector about Google or Facebook or whatever. Michael?
I have a question from Jason Petiot, who would like to go back to co-production, I guess, in the context of this. There was also some confusion with the triple helix. No, I think it's more about, because the question is just from now. So I think it's more about co-production in the context of this GDPR and exchange of information and so on. If I understand correctly the context now.
Yes, and what is the question?
Can you rephrase what co-production is?
Co-production is a practice by which you seek to actively involve the citizen or the client or the patient in the services that are meant for him. So it's about active involvement of the patient.
So in the context of my beautiful watch, the fact that I'm wearing the watch is co-production?
Well, it's a nice start, but if that is all you do, it's very passive. The problem is then how, for example, what do you do with the data that comes from that watch? Can you understand it? Is that data transparent for you?
One of the brand
what you do with that
mentioned tells me how to use it.
Yeah, what you do with that data. Does that watch prompt you to do something? Have you a say in the way that your watch prompts it for you? Etc., etc. And of course, this, well, I'll go ahead because it's, we have too many slides anyway. This aspect of co-production has fundamental implication for the way we think about privacy. Because if we define privacy narrowly as just, say, secrecy and the way a right of the citizen to hoard his data and to protect it, then co-production becomes fairly complicated. And what the co-production perspectives invite is to reframe privacy in a more relational conceptualization. And that is one of the issue, I think, that in one of our main findings at this very exploratory stage. And of course, if we go back to COVID tracing, we have something that is very, where co-production by the citizens was very limited, at least in an individual sense, in a sense of individual empowerment. There is co-production in the sense of producing externalities, as Mattijs said. But that is something that is fairly difficult to grasp for the citizens. Now, if you look at the way that was dealt with in the COVID tracing apps, there was an initial scare about privacy that got a response in the form of a framework by the two main providers of the mobile phone platforms. Apple and Google agreed between them to provide an API, an application programming interface, that allowed selected governments, agencies, to tap into the Bluetooth functionality of their phones. And in order to have that access, you had to comply with very stringent criteria in terms of privacy. You could use Bluetooth and exchange information about Bluetooth information only in very specific and restricted ways. And that is something which in the end worked out fairly well. Just a minute, Matthias. I round out the example about the COVID tracing apps, where actually most governments, after, at least in Europe, but not just in Europe, most governments actually went the Google Apple way and used that GAAN, Google Apple Exposure Notification, GAAN, framework to roll out their applications. Or even switch to that system after initially trying something else. With a few exceptions, France, Hungary, Australia. Hungary didn't really take off the ground. There were very few users, actually, 15, 20,000 users. In France and Australia, it was more consistent. And France and Australia managed to stick with their more centralized design that didn't rely on that framework, and that still was reasonably privacy compliant. So the takeaways from that case, there are certainly positive outcomes for privacy aspects. There was frustration by governments that, first of all, because the uptake by citizens of these apps was very limited, but also because the use of the Google Apple exposure notification framework allowed for very little integration with other public health policy measures, because it was very highly contained within the mobile phone. And there was a complaint by the loss of policy sovereignty, because actually it was very difficult for the countries to design something else. I mean, a few countries tried that, but they had tremendous technical problems in rolling that out. And finally, those apps actually, there's very little evidence that those apps contributed to epidemic containment. It doesn't seem to be very effective, but privacy was there just one of the problems. I mean, that inefficiency was only very partly due to privacy features. Matthias?
Yes, I think these takeaways are very interesting. I happened to be at the time as a member of the GIS, part of some discussions about the tracing app in the summer of 2020, and I must say it was striking all the hurdles. In the end, indeed, meant the app was not a game changer at all. I remember you as 20% of the people would use the app, but of course, since the idea is that you needed, both the person who gets the information and then the person who receives the information about the fact that they've been in contact with somebody, they both needed to use the app. It was 20% times 20%, so only 4% of the, if it were, of course, independently distributed, but only 4%. And we were joking about the fact that, in any case, all these things that are, all these hurdles for the state not to be excessively informed, the Googles and the Apples of this world, they find ways around it. And there is this view that RGPD is something that they know how to manage that. At times it's even a barrier to entry. So one question we often had at the time, and I don't know what your answer would be, aren't we implementing these rules excessively strictly? Like, for example, you connect the app, but then when you know that you are positive, you still can decide not to give the information. So there is a double hurdle. Now, while you might say, if indeed it says, look, I'm happy to be the app, well, once I get infected, then the information goes. So I don't know what's your view on the kind of hurdles we should put and how to balance this privacy versus the fact that we have this public concern of the epidemic.
Let me handle this question, Jan. You say, that's a fair point. That's basically also my criticism that we discussed when we looked at the COVID case. Were governments concentrating on the right questions? So their approach to privacy and their approach to handle the whole discussion about the COVID tracing app, at least in Switzerland, was about, okay, encryption, all these technical things that in the end, only very few people really care. And there was only very, very few people that thought about actual, let's say, use, how people will use the app. So there are many, many open points, not only, well, as you said, well, if you get positive, can you, will you share the information? Have you the possibility to withhold this information? Well, what happened in Switzerland is basically that people downloaded the app, but then, well, if you get positive, the mandate was to remain at home. So what happened? People stopped using the app. So that's so long story short, I think we thought too much about technical measures, about privacy, and thought very little about incentive systems so that people share the information. So if the thing is, if you're positive and you need to remain at home, well, for certain people this is also a loss in terms of money because they can't go to work, don't get paid, etc., etc. So you don't necessarily arrive to this important group of people that probably will be exposed most to COVID. So what I would like to say is basically that, well, it's all fine with this, but there is another dimension that governments didn't really think of, was the whole dimension of what happens once this app is distributed. How will people behave? How will people behave? How will people do workarounds? That's the thing. So there are some other examples you might also know, for example, the implementation of DRG. So how hospitals get paid. So the idea was that hospitals were basically optimizing their processes. What happens is they hired more coders to optimize how they write bills. So this kind of unusual, unintended use is nothing that governments are systematically exploring yet. That's the key message, I guess. Maybe you have some more ideas.
Yes, well, it's to try to further our reasoning in our presentation. It seems to me that this connects with our next point, which is the separation between use and design. And it's very tempting. I mean, the temptation that we saw in the COVID tracing app was to try to embed all the requirements in advance in an application, a mobile app, that would by itself solve our issues. And then the users would behave as expected. And that was Tobias' point. But of course, by doing so, you are making a number of hypotheses about how the people will use the app, how they will react to it, etc., etc. And so you risk falling prey to that separation between design and use. But the problem is that, of course, the people are generally not well represented. The users are generally not well represented at the design stage. And at the design stage, you have generally few fairly concentrated actors. And in some app and in some implementation, you have really an effort to get to user opinion, to test it, to watch how people use and reappropriate the object or the artifact or the functionality. Is it usable? What's the ergonomics? What's the people behaviors? And then there is reaction, and you can adapt your app. But of course, that's absolutely not what we saw with the COVID tracing app. You didn't get that feedback loop, or only very little. Yes, Michael?
So there was a question in the Q&A, which I think fits well with the current discussion. So sorry for interrupting, but it was how does cultural value on data privacy impact the participation? Because that's something you're not mentioning. You're mentioning individuals and the technology or the app and design and the interaction. But in terms of success of these apps, so I was thinking of Nordic countries where this kind of privacy is considered as not necessarily, I mean, it's not as narrow as what you were describing. And so are you researching that? That's part of the question. Is it something your research addresses? But did you look at how participation varies with these kind of cultural aspects?
No, we haven't looked into that, and we are even far from having enough empirical data at this stage to explore that sort of question. It's probably very relevant and relevant to the way that we conceive IT and artifacts to support co-creation in healthcare, and it will, and the needs will probably be different from one country, from one region to another. But at this stage, it's something. All that we can say is that it would need to be taken into account into that sort of feedback loop between design and use that we see here. And of course, when you have a one-size-fits-all model like the Google Apple exposure notification framework, it's not tailored to local needs, certainly not. Tobias, I see you fidgeting.
Yeah, I mean, it's not necessarily, well, it can be something on national culture or depending on national culture. But what we have seen, at least in other studies that I've been conducting, is it depends largely on first the type of data that is shared and also the purpose that this data will be shared. And in the end, there is also a lot of situational elements, which makes to give a concrete answer to this question will be very difficult. So it depends on the use, where the data is used, but also some situational specificities, like, for example, if you are ill, if I don't know, if there are some remuneration that you will get. So think about sharing your health information with insurance companies, etc., etc. So there are so many factors that makes it very, very hard to generalize, to give a general answer to culture. So there are so many facets that it makes it very difficult to generally say, well, it's different or not.
Yes, because one other thing that we come across is that, and that's what I'm trying to highlight with the examples, and I'll bring a third example soon, is that actually the stakes and the issues about sharing information are very different depending on the institutional settings in which you are. And well, actually, even it articulates nicely with the way we think about privacy. Well, of course, privacy has been analyzed a lot as philosophically as a right, and you can take a very individualistic take on that issue of privacy by seeing data as an asset that belongs to individuals. And then you have a utilitarian approach to privacy, where you have theories like privacy calculus, where people accept to give up a part of their information in exchange for a service. And that's very much what you see, for example, with the social media platforms. I mean, you accept to give up some of your information in exchange for a free, quote unquote, service by Meta or by Google, etc., etc. So you get free mail, you get free messaging, and that is the way that it has been framed in the commercial sector. But it's something that's probably certainly doesn't describe well many other interactions and many other settings that require exchanging information. Now, of course, you have critical frameworks that are critical and that unmask the evil of surveillance, either of surveillance capitalism, people like Zuboff or Michael Veal, people like that. But you also, the theoretical frameworks that drew our attention are what I call relational theories of privacy, that highlight the fact that actually people share information not just for a purpose, but in a given context. And what Helen Nissenbaum calls privacy in context is that people are even eager to share information within a certain context that encompasses not just a purpose, but people, an organization or institutional setting. And that makes that sharing on information meaningful in that context. And what is really a violation is when information is moved from one context to another. And then you break that contextual integrity. And of course, digitization of information and datafying individuals makes breaking this context very easy, because information and data becomes easy to transport. And that is precisely the business model of Meta and Google. It's to repurpose information. And of course, that then is felt as an affront and a violation of privacy. And that contextual integrity framework appeals to us because it, at least at a certain level, it makes sense from an administrative and management point of view, because it is not just about purposes in the general sense of the GDPR, for example. It's also about people and structures and flow, so it's very organizational in a way. And let's illustrate that with an example, which is Belgium's e-administration structure. The Belgian government, surprisingly, has evolved a fairly sophisticated system of information sharing about the citizen, where indeed information is generated only once, somewhere in the administrative system. And so you have decentralized authentical data sources, municipalities, hospitals, medical insurance companies, les mutuelles, etc., etc. And you have a number of gatekeepers who don't hold the data, but who only open communication between legitimate users of the data. And so you have presently six big gatekeepers, and eHealth, and the eHealth platform, the federal eHealth platform, is one of these gatekeepers. Let's focus on that. And actually that system of what's called the eHealth Hub, MetaHub system, is something that constituted itself from the bottom, from the ground up. You had hospital networks, you had hospitals that had patient files, which grouped into hospital networks, which more or less grouped into regional networks. I mean, for Flanders, there are two networks, one with mainly private hospitals and centered around the KU Leuven, and the other centered mainly around Ghent. And for Brussels and Wallonia, you have one single hospital network. And those then were connected through the federal eHealth portal, which also created connections to the NME, the sickness funds, general practitioners, pharmacists, etc., etc. And so, yeah, you have there a system that has grown from the bottom up, that has been progressively built. And I focused here on the situation in healthcare, but it's a bit the same that can be found back in other sectors like social security or corporations and firms, where actually privacy was defended probably by data controllers who saw themselves as custodians of their data, which in a way, they saw themselves as guaranteeing the data from their constituents, their users. Hospital A keeps the data of his patient. The Federal Unemployment Organization keeps the data of the unemployed. And the deal was to be able to connect all these administrations in a way that preserved that property of data within given institutional settings. And in many ways, that is structurally compatible with contextual integrity. And to that extent, yes, it can be privacy preserving, although all that system was constructed with little or no input from the citizens, actually. Citizens have been very little aware of the constitution of all that stuff. You didn't, Well, at some point, you probably signed an informed consent form, at least in the health sector. But for other sectors, for example, there was very little input from the citizens. This was mainly set up behind the scenes. Matthias?
Yes, and I think this idea of contextual integrity is very interesting. It can be tricky. For example, okay, we have in Belgium a system where you have state-provided health insurance, which is the basic one. But then you have also a lot of people who, through their job, can get extra complementary insurance, which can be public or private. And of course, private companies, they try and balance risks and benefits. And therefore, if you give them access to some of this health information, it will influence whether they are ready to cover you or not. And so there is a question, I'm not sure the system integrates enough the fact that different players may have very different incentives. I don't know what you think about that.
Well, we have no opinion yet beyond that intuitive impression that there is a theoretical framework that seems to fit, at least to a certain extent, those possibilities. But we're going to see with the last example that example tends to break down at the individual level. Last thing that I want to mention is that, of course, that system is subject to a lot of criticism. The whole information platform, you see there a reaction by Jacques de Teuf, and the respect he has for the watertightness of the databases and the fact that the data is not centralized. And he says that some sort of plumbing has been set up to create communication, but he is very wary of the fact that data might become more and more centralized. And the legitimacy of all that revolves a lot about the controls that are in place for the communication between the various users of that data. And so in order to ensure that legitimacy, you have to have a decent data protection authority, which in Belgium is not the case. Definitely, I mean, we have been warned by the European Commission, and there has been some media excitement about that.
I mean, that's the issue that Jan and Vincent and I are discussing quite often. Is it's not only about privacy; it's also about governance. And the issue is indeed that if you look in Europe, but also elsewhere, the data protection offices are heavily understaffed. In Switzerland, I think there are 20 or so people that need to take on the big guys, Microsofts, Amazons of the world. This is nothing. And it's not only about the structures, but it's also about the instruments that they have at their disposal. So they don't have direct access to companies to see how they are using the data or misusing the data. So that's the issue. They are lacking instruments, concrete governance instruments to see what is happening inside these black boxes, inside these health insurances. Right now, we are just relying on whistleblowing. Is this enough? I don't think so. So this was the big case in Switzerland 2 years ago, where we discussed about the introduction of electronic identity systems. And it was all about, well, can now private companies introduce electronic identity, etc. So the media concentrated on the debate about private and public and didn't really focus on the discussion about governance. And I think that's, in the end, it doesn't matter if it's private or public. In the end, it matters about how the government, are there any governance instruments that work? And right now, I don't believe that we have these instruments in place.
I would add that probably public administrations are in a situation that is a bit different from private firms. Because if you look, for example, at that Belgian system, there is a prospect there of having a single data protection authority and a unified control system. And there is, there is a fairly good prospect for coordination between all those data controllers and gateways. So it's, and that is something that is not duplicated in the private sector. If you look at the private sector, you have something that's much more fragmented than that, and that is probably connected through the exchange of advertising data through data brokers. And you would need to compare those two structures, which are probably very differently organized with very different incentives. So the prospects and the ways of governing that, as Tobias says, are probably different. And I don't even dare to think about the whole gray zone between the two, because of course that separation between private and public is not completely clear cut. So we're only just exploring things there. And indeed, getting to something that's well controlled is important. But what's interesting here is that we need to set something up which cannot just rely on individual notice and consent. And that is the point of people like Julie Cohen, when she says, look, you cannot just transfer the brunt of accepting and controlling all that data use upon users who are supposed to tick boxes and to say, yes, I agree, or no, I disagree. You have to take into account the context and the expectations of users, etc. And to have something that is much more structural. You cannot just do always with cookie consents. I mean, it just doesn't work, because that is a highly individualistic take. So there needs to be collective regulation. Now, the problem is that when we look at the individual behavior, that will be my closing points. If you look at the care relationship, then things get a bit strange, because we nearly get the impression that privacy there is not such a big issue. And of course, we compare that with all the excitement about privacy and lack of privacy that is reported in the media. Well, here you have a survey that was made for the Fondation Roi Baudouin last year. And you see that actually the public is pretty willing to share its data, at least with doctors and hospitals, and even with mutual insurance companies in Belgium. And things begin to deteriorate when it's for the pharmaceuticals or the police or public health policies. And once you go to private firms, well, then people don't agree anymore. Again, this points to the importance of context. People share their health data, and they expect it to be used by doctors and hospitals and research centers, and even mutual insurance, which comes across as a surprise to me, but anyway. and they disagree about it being reused for, I mean, the GDPR there would say that the purpose changes, but is it just the purpose that changes, or is it the nature of the actor and the people that change? And if you look at the doctor's opinion, well, okay, we have some evidence. For example, that's a survey, and no, it's not a survey. That was a qualitative inquiry with focus groups that was carried out by the KCE, the Centre d'Expertise en Santé Publique. Okay, they find that the general practitioners worry about data security, and you have a few of examples there. But actually, in their report, it's not such a big deal. Cost and usability of the apps and the whole e-health system there is much more important for them than privacy or data security. So, and is data security in the end something that's just created by the organizations and the way organizations and institutions use and handle individual data, or is it, or are people not aware enough of the stakes there? We're not sure. What we would advance as tentative results at this stage is that we need to shift our view of privacy from something that's highly technocentric and utilitarian to something that's much more interactive and organizational also in many ways. What we find also is that the IT industry reasons very much in terms of the value of information and tends to have a much more utilitarian take. And so outsourcing by governments exposes governments to that very individualistic view. Privacy by default and privacy by design is all very fine and well, provided that that design process includes organization and institutional aspects, meaning that privacy cannot just be contained within the artifact. It has to be conceived at the level of the whole organizations that use the information. And what we also find is that legal frameworks like the GDPR are fairly general, and that they do not give a lot of cues about design principles and good practices. And that is something that needs to be worked on. So there are still a lot of open questions about, is opt-out realistic? Do people really have a freedom of choice? What are those privacy design principles, especially in e-health contexts? And well, it leads us back to our initial question. I'm done here. Sorry for having
very much. We have a number of questions and suggestions online. I have one point to make about GDPR and actually all these new acts that they are passing currently. I'm quite surprised that we are creating these big legislations for, I mean, they are game-changing in an industry that is changing all the time. We don't know the impact. We don't know if it works, how it will work, etc. A bit what you were saying for these apps. right? The app is a super tiny, it's one point in a set. Huh? And these big acts or GDPR are supposed to change the whole dynamics of an industry. And they are voted and then set into stone. It's never for a period of time with a required reevaluation after 10 years or so. And exactly what you are describing here, you would like sometimes to have a capacity to have a version 2.0, you know, with the legislation voted, an evaluation, you know, a compulsory reevaluation and updating of the law after 10 years, then after 20 years. And it is never done in the logic of launching these big legislations. And I agree with you. You have this big box of GDPR. You don't know if it will, how it will operate in different sectors. And I find it's a pity that we cannot have this mode, interactive mode, this co-creation mode of saying, okay, in this sector it works well, in this other sector it should be amended and so on. So I see a few messages going around. We had one initial question by Jason Petiot, who was asking about co-production and the definition of co-production now. I don't know if Jason is available to ask the question live.
Yes, I am. So yes, I tried to understand what's from the context in the discussion. Wanted to make sure I understood correctly. So is co-production basically like the provider working with the customer in a collaborative manner in everyone's, I mean, in the respect of everyone's rights and freedom? Just basically Facebook not co-producing with me, but my doctors ask me to take my treatment or to lose weight to cooperate into me preventing a relapse of my disease or something like that. Is that a fair definition of co-production? But in the frame of this digital world, it's more like abstract or more indirect, maybe.
Yes, I guess your phrasing is good. I'm sitting well with it. I would perhaps add an even more active role for the patient, which is really patient empowerment and patient-centered care. So it's really, there's an additional notion there of not just complying, of not just doing what the doctor asks, but of pursuing a certain equality of power and of information and things like that. And so it might be, well, we probably agree, but I would insist on that empowerment aspect. And the way in which digitization interferes with that, well, that's the whole question. One extreme point of view and a way to problematize it is to say that actually digitization prevents co-production because it is highly contained and technical, and it's basically take it or leave it. And there's nothing you can do about co-production with technical artifacts. Actually, technical artifacts alienate you, and I don't think that's true. But it's one way. It's an interesting way of asking the question. Again, it goes back to Michael's question initially about the watch. What does that empower him to do? And a lot of that depends on the way the interface of the watch is designed and the way Michael can use, access, repurpose the data that is generated.
Okay. I would argue that digitization can very much empower patients, because if you look at 20 years ago when there was one copy of every x-ray and that only one doctor in the hospital could have it at one time, the patient would never have it And thus, like, if you digitize it, you make knowledge freely available to anyone, and you make this choice possible because it can be accessible to more than once. And so co-production, if there's only one copy, you can't anything. There's only one person active at a time. So yeah, like, thanks.
Thank you.
Thank you. I see two other people with comments who are present here as co-panelists now, Sarah Roda and then Antonio Estache. And I also saw a question, I don't know if it's been actually answered or not, by Joyce Zoe Banks. So I don't know if we need to have a third question afterwards or if that point is solved. Sarah, in the meantime.
Yes, hello, thank you for the interesting discussion. So I work for an association that represents European doctors, actually, Standing Committee of European Doctors. And so I wanted to bring it up a point in relation to professional secrecy and medical confidentiality. So this is really one of the main reasons that patients trust doctors that will use the data as what is the initial purpose of treatment and diagnosis. And so that is a little bit on that point. But what I don't see a lot of discussion is about IT professionals. So they are the ones in charge of this architecture. And thank you for the design of the Belgian structure, which was really interesting, the way that it was presented. So IT professionals are not subject to professional secrecy. They do have or might have contractual liability or contractual secrecy. But if they move from one hospital to another, or if they are fired for certain reasons, no one knows, and no one they are not subject to disciplinary sanctions. So I think this is something that it should start being elevated. Also, that IT professionals have some accountability and to regulation because of health data sharing and how it will be done in the future. And we don't see a lot of that. And we also see a scarcity of IT professionals. So they really decide everything on where they want and how, in what terms. So even if a hospital does demand certain assurances, they just simply might not be interested in go to another one. So I just wanted to learn a little bit of what do you think it could be done further, at least in Belgium, on to make this more accountable, and perhaps a professional association on that is subject to disciplinary sanctions in these regards. And I also shared a recent survey from an association called BUC, which is a consumers organization, and they have also analyzed on health data sharing because of the European health data space regulation proposal, where a lot of discussion will come, especially in what they have the primary use and the secondary use. So they define it, the primary use, the relationship between the patient and the healthcare professional or provider, so for diagnosis and treatment, and it will be the electronic health records. And then the secondary use, where they say that the health data holders, which could be doctors, clinical practices, and other industry, have to make the data available for secondary use on a mandatory way. So this is also something that we feel that it can be quite damaging also in the future for the trust. So new regulations at EU level that would be allowing also more data sharing in our universe. Thank you so much.
So maybe let me start, Jan, so that you have a little bit more time to reflect about the Belgium case. But the issue is that one of the issues that why this is not happening is because IT professionals is not a protected title. Everybody can be an IT professional. It's not like a doctor or a lawyer that usually needs to take an exam or something. So at one point you are an IT professional, and then when it comes to liabilities, you aren't. You are a service provider, something that is not subject of this law. So that's a little bit the issue that I see, that well, it's not a protected profession, so it's pretty hard to grasp then who will then be under this regulation or this sanctioning mechanisms that you or control mechanisms that you suggest. So that's a little bit from an implementation perspective the issue that I see.
But also, it seems to me that in the end, the IT professionals mostly are not data controllers. They are processes in the GDPR sense, but they are not controls. They don't own the data. Or they have, if they want to express it in terms of ownership, they don't have custody or stewardship about the data. Yes, they have stewardship, but then that goes back to the rules which those processes, the service providers apply in their internal functioning. And that is a bit of a black box at the time. To that extent, I would agree with your comment. I'm not sure it's about professional secrecy, but it certainly is about the internal regulation and the way those IT firms work and the standards they apply to their own functioning.
Last but not least, we have Antonio Estache, and I'm seizing the opportunity to advertise a seminar which will be on June 5. Antonio.
Can you hear me?
Yes, we can.
Hello, Antonio.
All right. A quick reaction on the previous comment, if you don't mind. You can't create a contractual secrecy commitment with the IT firms. So there are ways actually of making sure that the people who are working on the data will not be allowed to use the data in any way and attached via, sort of fines and punishments or whatever type you want to that kind of thing. So it's the equivalent if you want. I know we used to do this at the World Bank on specific data sets. It's a contractual agreement that you can implement. And I think that eventually they will move on to these sort of issues. But let me go back to my two questions. One is a suggestion mostly. When I've looked for the budgetary cost to the government to supervise anything, and in particular the kind of stuff that you guys are working on, I've never seen any data. So one interesting exercise would be to look at some sort of assessment for different definitions of privacy or different degrees of privacy of what it would cost the government to implement that. Because an easy excuse is we don't have the money. Okay, so what do you want to buy and how much is going to cost? That would be one exercise that I think would have quite a lot of value added from a policy perspective, because it will sort of reinforce the need to allocate budget to these kind of activities. The second thing that you may want to look at, which is related to one of the comments that you guys have made, is, I don't know if you know this, but Grapple, there's an institution at the EU that looks at the degree of corruption across countries. And they come up with suggestions, with advice, with recommendations. And some of these recommendations are also linked to budgets. And one of the interesting readings of what they do in the diagnostics is to look at the extent to which governments are very good at coming up with organizational charts with which identified specific positions and functions and things like this, but very bad at allocating budgets to that. And Belgium is particularly bad. So we have lots of very nice organizational charts in Belgium, but unfunded. So de facto, they don't exist. And that's another way of maybe of sort of complementing your argument that the governance structure is really weak if you don't have money allocated to that, even if you do have positions allocated to that. So the staffing issues and the recruitment process is something that needs to be looked at from a policy perspective as well, because that's, you can write all the laws and all the regulations that you want. If you don't have the staff or the technical information to be able to process that, it's not going to happen. I'm done. Yeah, maybe a last point I just remember. If you look at the ownership structure of hospitals across Europe, they're following the lead of the US. That's what I'll talk about in the seminar next time. Common ownership is becoming a major issue. So I think it's very, very difficult to try to guarantee that the common owners in different types of facilities, which are supposed to be separated to protect privacy, it's very difficult to make sure that they don't share the information across the activities that they work on. This is one issue that competition policies have been started to look at, and it has some implication for what you guys are doing. There is a debate going on at the FTC in the US that you may want to have a look at. And there was, as part of the congressional hearings in the US, there were some discussions of these issues as well. So the private equity fund that owns different parts of the whole supply chain of health activities may have information that otherwise would have been separated, but that actually would end up in the same database. You may want to look at that as well. Good luck.
Thank you.
So as you understood, there is room for multiple seminars exactly on that topic. Please provide an answer, but the clock is ticking, so I will have to restrict the amount of time you can use for that.
Yeah, just a short reply. Yeah. Well, do you trust an antitrust as the title of a paper that I read sounded. I'm not sure that antitrust regulation is actually enough to take care of that issue of data sharing. But beyond that, I guess that national health insurance systems would need to impose obligations of data sharing and rules about data sharing to hospitals benefiting. But I indeed, I have no clue about how that works and what the rules are in the US and how that would look in Europe. Your idea about looking about the different costs of various concepts of privacy is very intriguing. I mean, I'll keep that in mind because it would be an interesting way of trying to assess those different conceptions of privacy and the enforcement costs.
Thank you. I don't know if Tobias or Vincent want to provide the last word.
All good from my side. I thank Jan for taking the lead.
Yeah, thank you, Jan, for taking the lead on this and the presentation. So
thank the three of you for this wonderful and insightful presentation, thoughtful and thought-provoking presentation. I think we have indeed room for multiple seminars and research ahead. I want to thank again all the participants for their interactivity. It was great having this intense Q&A at the end. I'm sorry that I have to shut it down, and I'm looking forward to seeing all of you again in a bit less than a month's time with Antonio's fascinating, I'm sure, seminar as well. Have a good day.
Thank you.
Thank you very much for having us.